Ladies, if you're having pain with sex, I'm going to give you some tips and tricks on how you can treat this at home. Women can have pain with sex for multiple reasons. Some women have pelvic conditions like endometriosis or fibroids, and other women don't have any pelvic conditions at all, but they're still having pain with intercourse. If you're a young woman, not yet in menopause, and you've had discomfort with penetration, say with tampon use or a pelvic exam, then it's very likely that you have pelvic floor dysfunction or tight pelvic floor muscles that are causing this pain with penetration. I want you to know that this condition is highly treatable and I see a very high success rate in the clinic. Talk to your doctor and let's make sure there aren't any underlying conditions that need to be treated medically. If your doctor tells you that everything looks normal or that you have tight pelvic floor muscles, then there are things that you can do at home to treat this. So if you have pain with penetration, then you already know that there's some anxiety there with the thoughts of penetration or attempted penetration. And the first step is learning how to relax and open up your pelvic muscles. This can be attained with doing deep breathing and relaxation techniques, and more importantly, reverse Kegels. Reverse Kegels is active relaxation of your pelvic floor muscles that helps your muscles open, relax, and lengthen. Most of us, when we're anticipating pain, are going to tighten and guard those muscles, which would make penetration even more uncomfortable. It's essentially deep breathing paired with an active relaxation, kind of feeling like you're pushing out, like you're going to pass gas. There's no straining. Think about how do you open and relax your pelvic muscles. Watch the video for more detail. 2, we're going to have to start working on penetration. Easy, gentle penetration. At first by yourself, and we will work with your partner later. This is best attained with a set of dilators. Don't let this scare you. They come in a very small to large sizes, and we can start with the smallest size that is comfortable for you. You're going to train yourself how to relax and open your muscles as you gently penetrate with the smallest dilator. Over time, we're going to be able to move it around to use it to stretch. And once that becomes easy, we're going to move on to the next size dilator and repeat that whole process again until we are able to use the dilator the size of your partner or a speculum, depending on your goal for pelvic exams or comfortable intercourse. The third part are pelvic stretches. There are exercises that you can do to help stretch your pelvic floor muscles. They include yoga poses like a child pose, a happy baby, a deep squat hold. All of those are just a few examples on how to stretch your pelvic floor, and I will also link my video below on pelvic floor stretches that you can do at home. So just to recap, if you're having pain with intercourse, we should learn how to reverse Kegel, also known as actively relax your pelvic floor. 2, we need to manually work on penetration and stretching out the vaginal tissues and getting that vaginal opening more stretched out and open. And 3, we can help that by doing pelvic stretches at home. As far as how long it'll take, it varies for everyone, of course, depending on how severe the situation is and how long you've been dealing with this condition. I've seen women be able to have sex as quickly as a month. And for some of my patients who've been dealing with this for a long time, it's taken up to a year. Most patients I've seen take about 3 to 4 months before they're able to have comfortable intercourse. If you have this condition, you are not alone and there's treatment available. If you're still struggling, you should find a healthcare provider that's going to guide you through this process. I hope that clears things up on how you can treat painful sex at home. Please post your questions below and I'm happy to answer any of them that you have. Thank you so much for watching.